Manx Radio.
Alex Brindley with you in the afternoon through until 6 o'clock this evening. Now, we all look in the mirror in the morning, don't we? And we see maybe one or two crow's feet appearing. We look at parts of our body and we think, oh, maybe, they're not as good looking as they used to be. A little bit of grey hair here. Would you go as far as reversing the ageing process? But would you do it in order to boost your career? That's what we're going to be talking about now with Dr. Zach Ally, who's a pioneering physician and CEO and founder of Derma Medical. Zach, good afternoon.
Good afternoon.
Now, I know you've had some research done, haven't you, that shows about how many of us are actually thinking about trying to reverse the ageing process, improving our body aesthetics. What does the research show?
So our research, UK Media Launch, showed that nearly 1/3 of UK adults have aesthetic treatments when it comes to changing jobs or a career. And that really shows how important they see youthfulness as success in the working place. It also showed that 1 in 5 women in the UK have dermal fillers to turn back the clock, and 25% increase in men undergoing treatments as well.
I wonder why. Let's look at the male side of it for a moment, because when it came to having aesthetic treatments, it did seem to be, I'm not being stereotypical here, but it did seem to be more that ladies went for this. Why do you think the men are getting in on the act?
Absolutely. It used to be very much female-dominated. In fact, 90% of all aesthetic procedures were carried out on women, and the survey showed 25% increase amongst men. I think the reason for it really is multiple things. First of all, awareness is out there. More people know what's available and what can be done. People also recognise that this kind of work is not like having an operation. It's not surgical. It's not a surgical procedure. You don't have to be in an operating theatre or worry about complications as much. It's minimally invasive, which means that rather than having an operation, you can simply insert a needle under the skin and insert the products. It's cheaper, it's reversible, and a lot of the time it's not permanent. So these are all factors that have driven the exponential rise in demand for Botox and fillers.
Now, why do you think it is that there's this link, according to your research, between the change in the career? Do you think it? We've all said for many years, haven't we, that when it came to, as it was known, cosmetic surgery, or it was all about self-confidence. Do you think that when people move on in their career, they need that sort of self-confidence boost?
I don't think they need it, but I think nowadays it's something that people look at a lot more. There's that common saying, you wouldn't go to a dentist with bad teeth. And that ethos really applies in most industries. People know that it's something that can be done fairly simply and it has very good results, and people recognise that it has an effect on their confidence. And if people look good and they feel good, it reflects on their work and their industry.
From your point of view as a physician, I'm ironically turning back the clock here a few years, and it used to be something that was seen as quite drastic measures that people wanted to change their aesthetics of their body. Do you think that now that the procedures have become, as you mentioned, less
minimally invasive, yeah.
Thank you, invasive, not evasive. Minimally invasive. Do you think that that's the reason they're becoming more commonplace?
I think yes. I think certainly that is one of many reasons. You're right. You often hear the drasticness or the negative media hype. Often what goes wrong, or the horror stories with Botox and dermal fillers in the industry. But our notion really is to push what's actually right and what can go right when it's done successfully. And what we really do is to train doctors and other healthcare professionals with a landmark-based training to make sure they've done things safely, they've mapped out the safe areas, and they use a product which is safe and natural-looking. And the ethos of you can always top up, if subtle, but you can't go down if aggressive, is something that we push forward, so things are done properly.
Well, let's you've mentioned it there. Let's address the fact that there's this negative media sort of stereotype that goes with the industry. Do you personally think that people, both men and women, trying to turn back time for careers? I know it's to please their partners as well. Is another. Do you think that's right?
I don't think it's wrong. I think that it's personal preference. If somebody wants to go and get their hair done, or buy a new suit, or do something for an occasion, or just to make themselves feel better. There are ways of doing it safely, and there are ways of using products that make it look natural without overdoing things. And I think a lot of that responsibility comes down to the physician who's actually undertaking the treatment and the manufacturer who's producing a product which matches their description. And all of this is tied in quite nicely with a consultation. Now, these treatments they're not given out. We do a consultation, and we sit there with the patient and go through all the risks and benefits. And it's equally as important to say no when somebody's not a candidate as it is to say yes. So all of these factors are addressed, and then the patient gets to go home and think about it before actually undergoing the treatment. So the process is very effective, and people can learn what's out there.
And you hinted at it there, finally, that it's not just about moving on in your career or pleasing your partner. They can be special occasions, sort of milestones in life where people, as you mentioned, it's along the lines of going and getting your hair done specially, your makeup and things like this for big occasions, I'd imagine.
Absolutely. I mean, there's also a difference in the age of people undertaking certain treatments. Your 80-year-old lady is not going to want larger lips and big cheekbones. she's going to want to refresh and revitalise and create a subtle lifting effect to rejuvenate what she already has. Whereas your younger clientele is going to want to prevent the ageing process and catch things before they deepen or make her look tired. So these factors are all taken into account in the consultation when we see patients.
Oh, crikey, mate. Improving me and making me not look tired. Zach, I'll take your number after this. If people want to find out more information about this, maybe they're interested in the kind of treatments themselves, and where can they go online for more information?
There's two places, really. I mean, Intraline.com tells you about the product. It tells you about, where you can learn all about the product and how it works. And dermamedical.co.uk helps practitioners train up and learn the ins and outs of how to do things safely.
It's been a delight talking to you, Dr. Zach Ally, who hopefully is going to make me look 21 again. Thank you very much for joining.